You trust your local grocery store, the bright meat cases, the familiar brands, the cuts you've bought for years. But some of those perfectly packaged meats could be silently threatening your health, especially if you're over 60. Aging bodies process food differently. Immune systems weaken, kidneys work harder, and stomach acid declines, allowing harmful bacteria to multiply quickly. That's why contamination risks, processing failures, and chemical additives hit seniors far harder than younger adults. In this video, I'm exposing 9 grocery store meats that could send older adults to the emergency room, along with the warning signs to watch for before you buy. These dangers aren't visible on the label. Trusted products have caused severe infections, hidden chemical reactions, and dangerous blood pressure spikes. And because the meat industry runs on thin margins, shortcuts and delayed recalls mean contaminated products often reach your kitchen before anyone realizes there's a problem. Coming in at number 9, we've got prepackaged deli meats from major chain stores. These aren't the meats sliced fresh at the deli counter. I'm talking about those sealed packages of sliced turkey, ham, and roast beef sitting in the refrigerated section. They promise convenience and longer shelf life, but that convenience comes with serious risks for senior consumers. These prepackaged meats undergo extensive processing to achieve their extended shelf life. They're pumped full of sodium nitrates, sodium nitrites, and other preservatives that can interact dangerously with blood pressure medications. For seniors taking ACE inhibitors or diuretics, the sodium load from just 2 servings can trigger swelling, shortness of breath, and dangerous blood pressure fluctuations. But the real danger lies in the processing environment. Large-scale meat processing facilities handle millions of pounds of product daily. Cross-contamination between different batches, inadequate cleaning between production runs, and temperature control failures create perfect conditions for bacterial growth. Listeria monocytogenes thrives in these environments and can survive even proper refrigeration temperatures. Consumer Reports from 2024 documented multiple instances where prepackaged deli meats tested positive for Listeria contamination weeks after reaching store shelves. The bacteria doesn't change the appearance, smell, or texture of the meat. You can't detect it without laboratory testing. For seniors, Listeria infection can cause meningitis, blood poisoning, and in severe cases, death. One particularly disturbing case involved a batch of prepackaged turkey breast that remained on shelves for 3 weeks after contamination was detected at the processing facility. The company's internal communications, revealed through litigation, showed they knew about potential contamination, but delayed the recall to avoid financial losses during a high sales period. Dozens of seniors were hospitalized before the recall finally happened. The packaging itself creates additional problems. Those sealed plastic containers create anaerobic environments where certain bacteria can multiply rapidly once the package is opened. The modified atmosphere packaging used to extend shelf life can mask the normal signs of spoilage that would warn you away from contaminated meat. Storage temperature failures compound these risks. If the cold chain breaks down during transport or storage, bacteria can multiply to dangerous levels while the meat still appears fresh. Senior shoppers often keep these packages for weeks, assuming the sealed packaging protects them. But once opened, the clock starts ticking much faster than most people realize. At number 8, we're looking at mechanically separated chicken, often found in hot dogs, chicken nuggets, and processed chicken products. This meat product is created by forcing chicken bones and attached tissue through high-pressure machines that separate any remaining meat from the bone structure. The result is a paste-like substance that gets reformed into familiar shapes. The mechanical separation process creates numerous contamination opportunities. Bone fragments, cartilage, and other tissue that would normally be discarded get incorporated into the final product. For seniors with dental work, crowns, or bridges, these hidden bone fragments can cause serious dental emergencies. Emergency room visits for broken teeth or damaged dental work from unexpected hard fragments in processed chicken products happen more often than most people realize. But the contamination risks go beyond physical hazards. The high-pressure processing breaks down cellular structures, creating ideal conditions for bacterial growth. Salmonella and Campylobacter bacteria can survive the processing and multiply rapidly in the paste-like environment. Traditional cooking methods don't always reach the internal temperatures needed to kill these bacteria throughout the reformed product. Quality control in mechanically separated chicken production relies heavily on automated systems that can miss contamination. Visual inspection becomes nearly impossible when the product is a uniform paste, Random testing catches only a fraction of contaminated batches, and those test results often come back after the product has already reached consumers. For seniors taking immunosuppressive medications or dealing with conditions like diabetes or kidney disease, foodborne illness from contaminated mechanically separated chicken can be life-threatening. The bacterial load in these products can overwhelm compromised immune systems, leading to sepsis, organ failure, and extended hospitalizations. Processing facilities for mechanically separated chicken have been cited repeatedly for sanitation violations, inadequate temperature controls, and cross-contamination between production lines. Internal industry documents show that companies often prioritize production speed over safety protocols, knowing that detection of problems typically happens after distribution. The labeling requirements for mechanically separated chicken are minimal. Products containing this ingredient might list it simply as chicken or poultry without specifying the mechanical separation process. Consumers assume they're buying whole muscle meat when they're actually getting a processed paste product with higher contamination risks. At number 7, we have farm-raised salmon from discount grocery chains. The pink flesh looks healthy, the price seems reasonable, and the omega-3 benefits get promoted heavily in health magazines. But behind that appealing appearance lies a contamination story that could devastate senior health in ways most shoppers never imagine. Farm-raised salmon operations cram thousands of fish into cramped underwater pens, where disease spreads rapidly through the population. To combat this, fish farmers pump these salmon full of antibiotics, many of which are banned for use in land animals but somehow remain legal for aquaculture. These antibiotic residues don't disappear when the fish reaches your dinner plate. For seniors taking multiple medications, antibiotic residues in farm-raised salmon can interfere with prescription drugs in dangerous ways. Blood thinners become less effective. Heart medications get metabolized differently. Diabetes drugs can cause unexpected blood sugar fluctuations when combined with antibiotic residues that your doctor never factored into your treatment plan. The feed given to farm-raised salmon contains artificial coloring agents to create that appealing pink color consumers expect. Without these dyes, farm-raised salmon would be an unappetizing gray color. These synthetic colorants, particularly canthaxanthin and astaxanthin analogs, can accumulate in senior bodies that process toxins more slowly than younger systems. Recent testing by independent food safety laboratories revealed concerning levels of PCBs, polychlorinated biphenyls, in farm-raised salmon from major grocery chains. These industrial chemicals concentrate in fish fat and can't be removed by normal cooking methods. PCB exposure has been linked to cognitive decline, immune system suppression, and increased cancer risk, all particular concerns for older adults. The pen-raised environment creates additional contamination risks that wild salmon never face. Sea lice infestations spread rapidly through crowded fish farms, requiring chemical treatments that leave residues in the fish flesh. Copper-based anti-fouling agents used to prevent algae growth in the pens leach into the salmon tissue, creating heavy metal exposure risks for consumers. Fish farm locations often overlap with industrial pollution zones, where mercury, lead, and other heavy metals concentrate in sediments. Farm-raised salmon absorb these contaminants through their gills and digestive systems throughout their lives. For seniors already dealing with kidney function decline, additional heavy metal exposure can accelerate organ damage and create medication complications. Storage and transport failures compound these inherent contamination risks. Farm-raised salmon travels thousands of miles from production facilities to grocery stores, often spending weeks in transport containers where temperature control failures can allow bacterial growth. The modified atmosphere packaging used to extend shelf life can mask spoilage odors that would normally warn consumers away from contaminated fish. Moving to number 6, we encounter preformed hamburger patties sold in the freezer section. These convenient discs promise backyard barbecue taste with minimal preparation, but the manufacturing process creates contamination risks that can turn family dinners into medical emergencies for senior consumers. The meat used in preformed patties comes from multiple sources that get combined during processing. A single patty might contain beef from dozens of different cattle, processed at different facilities with different safety standards. This mixing process spreads any contamination throughout entire production batches, turning isolated problems into widespread health threats. E. coli O157. 7. Contamination in ground beef products has led to numerous recalls and hospitalizations, with seniors facing the highest risk of severe complications. The bacteria can survive freezing temperatures and even proper cooking if the internal temperature doesn't reach safe levels throughout the patty. Preformed frozen patties often cook unevenly, creating pockets where dangerous bacteria survive. The binding agents used to hold preformed patties together include phosphates, carrageenan, and other additives that can cause digestive distress in sensitive individuals. For seniors with inflammatory bowel conditions or those taking medications that affect digestion, these additives can trigger severe gastrointestinal symptoms that mimic food poisoning. Processing facilities for preformed patties operate at massive scales where quality control becomes increasingly difficult. Automated equipment that forms and packages the patties can spread contamination from a single contaminated batch across thousands of individual packages. By the time problems are detected, contaminated products have already reached grocery store freezers across multiple states. The freezing process used to preserve preformed patties doesn't kill bacteria, it only slows their growth. When patties thaw either in your refrigerator or during transport, surviving bacteria can multiply rapidly. Temperature fluctuations during shipping and storage create ideal conditions for bacterial growth that consumers never detect until after consumption. Quality control testing for preformed patties typically involves sampling a tiny percentage of production batches. Statistical sampling methods mean that contaminated batches slip through testing protocols, especially when contamination levels are low, but still dangerous for vulnerable populations like seniors. At number 5, we're examining processed breakfast meats like sausage links, breakfast patties, and bacon from major national brands. These morning staples contain preservative levels and processing shortcuts that create particular health hazards for older consumers managing chronic conditions. Sodium nitrate and sodium nitrite preservatives in processed breakfast meats can cause dangerous blood pressure spikes in seniors taking cardiovascular medications. The interaction between these preservatives and common blood pressure drugs can trigger hypertensive crises requiring emergency medical intervention. Many seniors consume these products daily without realizing the cumulative effect on their cardiovascular system. The high sodium content in breakfast meats poses additional risks for seniors managing heart failure, kidney disease, or hypertension. A typical serving of processed breakfast sausage contains over 400 milligrams of sodium, nearly a quarter of the daily recommended limit. For seniors on fluid restrictions or diuretic medications, this sodium load can cause dangerous fluid retention and electrolyte imbalances. Processing facilities for breakfast meats often use mechanical recovery systems that incorporate tissues and organs not typically considered muscle meat. These recovery processes can introduce bacterial contamination from internal organs that carry higher pathogen loads than muscle tissue. Quality control systems aren't designed to detect this type of contamination in the final processed product. The casing materials used for sausage links and similar products can harbor bacterial growth between the casing and meat filling. Listeria and other dangerous bacteria can survive in these spaces even when the meat itself appears properly cooked. Seniors with compromised immune systems face particular risks from these hidden bacterial reservoirs. Temperature abuse during manufacturing, storage, and transport creates additional contamination opportunities for breakfast meat products. The high fat content in these products provides ideal growing conditions for bacteria when temperature controls fail. Unlike fresh meat where spoilage becomes obvious, processed breakfast meats can harbor dangerous bacterial levels while still appearing and smelling normal. Artificial flavoring systems and color enhancers in breakfast meats include chemicals that can interfere with medication absorption in senior digestive systems. These interactions can make prescription drugs less effective or cause unexpected side effects that physicians don't anticipate when prescribing medications for older patients. Manufacturing shortcuts in breakfast meat production have increased dramatically as companies try to meet growing demand while maintaining profit margins. Automated injection systems that add preservatives and flavor enhancers often malfunction, creating pockets of concentrated chemicals that can cause severe reactions in sensitive individuals. For seniors with kidney function decline, these chemical concentrations can overwhelm already stressed organs and create toxicity levels requiring dialysis treatment. Coming in at number 4, we have pre-seasoned ground turkey products that promise healthy alternatives to beef, but hide processing dangers that make them particularly hazardous for senior consumption. The marketing emphasizes lean protein and heart-healthy benefits, but the reality behind these products tells a different story entirely. Ground turkey processing involves combining meat from multiple birds, often from different production facilities with varying safety standards. This mixing creates cross-contamination opportunities, where salmonella from a single infected bird can spread throughout entire production batches. Unlike whole turkey, where contamination typically remains on the surface, ground products distribute bacteria throughout the meat mass. The pre-seasoning process introduces additional contamination vectors through flavoring systems that aren't subject to the same safety protocols as meat handling. Seasoning blends often contain garlic powder, onion powder, and other ingredients that can mask the early signs of spoilage that would normally alert consumers to dangerous bacterial growth. For seniors whose sense of smell and taste decline with age, these masking effects create particularly dangerous situations. Salmonella contamination in ground turkey has caused numerous outbreaks, specifically affecting older adults with higher hospitalization and mortality rates than younger populations. The bacteria can survive in ground turkey even when the surface appears properly cooked, especially in thicker portions where heat penetration remains inadequate. Seniors often prefer well-done meat, but even thorough cooking doesn't guarantee safety when contamination levels exceed normal bacterial loads. Processing facilities for ground turkey often operate with minimal oversight compared to beef processing plants. Industry reports show higher rates of sanitation violations, inadequate temperature controls, and insufficient pathogen testing in turkey processing compared to other meat production. These systemic failures create ongoing contamination risks that particularly threaten immunocompromised seniors. The binding agents and moisture retention systems used in pre-seasoned ground turkey include phosphates and modified starches that can cause severe digestive reactions in seniors taking certain medications. Proton pump inhibitors, commonly prescribed for acid reflux in older adults, interact with these additives to create malabsorption problems and nutrient deficiencies that develop gradually over months of regular consumption. Storage requirements for ground turkey are more stringent than many consumers realize, but grocery stores often fail to maintain proper temperatures throughout the cold chain. Temperature fluctuations during transport and display can allow rapid bacterial multiplication that makes even properly handled products dangerous by the time they reach consumer kitchens. At number 3, we're looking at frozen breaded chicken products, including nuggets, tenders, and patties, that appear fully cooked but often contain raw or undercooked centers that pose serious health risks for senior consumers. The golden brown exterior creates a false sense of safety that has led to numerous foodborne illness outbreaks. The breading process used on these products creates an insulation barrier that prevents heat from penetrating evenly during the initial cooking process. Manufacturing facilities often rely on surface browning to indicate doneness, but the interior portions can remain at temperatures where Salmonella and Campylobacter bacteria survive and multiply. This partial cooking creates products that appear safe but harbor dangerous pathogen levels. Frozen storage doesn't eliminate bacteria in breaded chicken products. It only suspends bacterial growth until thawing occurs. When consumers heat these products in conventional ovens or microwaves, uneven heating can create temperature variations where bacteria survive in cooler spots while the exterior reaches safe temperatures. Seniors often reheat these products multiple times, creating additional opportunities for bacterial multiplication. The chicken meat used in breaded products often comes from mechanically deboned sources where bone fragments, cartilage, and connective tissue get incorporated into the final product. These materials can carry higher bacterial loads than whole muscle meat and create texture variations that make proper cooking assessment difficult for consumers with declining vision or manual dexterity. Quality control in frozen breaded chicken production relies heavily on automated systems that measure surface temperature rather than internal temperature throughout the product. This monitoring approach misses contamination in interior portions where bacteria can survive the manufacturing process and multiply during storage and handling phases. Cross-contamination in production facilities occurs when raw chicken processing lines operate near breaded product lines without adequate separation protocols. Airborne bacteria, contaminated equipment, and worker movement between processing areas can introduce pathogens to products that consumers assume are fully cooked and safe for immediate consumption. The packaging and labeling for frozen breaded chicken products often uses terminology that confuses consumers about cooking requirements. Terms like heat and serve or ready to cook don't clearly communicate the need for thorough internal heating to eliminate bacterial contamination. Seniors may interpret these labels as indicating the products are safe to eat with minimal heating. Moving to number 2, we encounter lunch meat from discount grocery store brands that cut costs through processing shortcuts and inferior quality control measures. These products often appear identical to premium brands, but hide contamination risks and chemical additives that create serious health hazards for senior consumers. Discount lunch meat production typically involves lower grade meat sources, extended processing times, and reduced safety testing compared to premium brands. Cost cutting measures include using meat from older animals, incorporating more mechanically recovered meat, and extending shelf life through aggressive preservative treatments that can overwhelm senior metabolic systems. The slicing and packaging equipment used for discount lunch meats often operates with less frequent cleaning and sanitization cycles compared to premium production facilities. Listeria bacteria can establish persistent colonies in processing equipment that contaminate successive production batches over extended periods. These bacterial reservoirs remain undetected until serious outbreaks occur. Preservative levels in discount lunch meats frequently exceed those found in premium products, with sodium nitrite and nitrate concentrations that can trigger dangerous reactions in seniors taking heart medications. The interaction between these preservatives and common cardiovascular drugs can cause blood pressure fluctuations, chest pain, and other cardiac symptoms that require emergency medical attention. Quality control testing for discount lunch meat brands typically involves less frequent sampling and lower sensitivity detection methods compared to premium manufacturers. This reduced oversight means contaminated batches can reach consumers without detection, particularly when contamination levels fall below testing thresholds but remain dangerous for vulnerable populations. The meat sourcing for discount brands often involves longer supply chains, with multiple intermediary processors, creating additional contamination opportunities and reduced traceability when problems occur. When recalls become necessary, identifying and removing all affected products becomes nearly impossible due to complex distribution networks and inadequate tracking systems. Storage conditions for discount lunch meats may not meet the same standards as premium products, with longer warehouse storage times and less stringent temperature monitoring throughout the distribution chain. These storage failures can allow bacterial growth that makes products dangerous, even when they appear fresh and within expiration dates. At number 1, we have rotisserie chicken from grocery store hot bars that seems fresh and convenient, but harbors contamination risks that make it particularly dangerous for senior consumption. The appeal of ready-to-eat convenience masks serious food safety problems that can cause severe illness in older adults. The holding temperatures for rotisserie chicken in grocery store displays often fluctuate throughout the day as heating elements cycle on and off, and display cases are opened repeatedly. These temperature variations create danger zones where bacteria can multiply rapidly while the chicken appears hot and safe. Senior shopping during off-peak hours may encounter products that have been sitting in unsafe temperature ranges for hours. Cross-contamination occurs when raw chicken juices drip onto cooked rotisserie products during preparation and display phases. Inadequate cleaning between batches, contaminated utensils, and shared preparation surfaces can introduce dangerous bacteria to products that consumers assume are safe for immediate consumption without additional heating. There you have it. 9 grocery store meats that could turn your next meal into a medical emergency. From the listeria lurking in prepackaged deli meats to the bacterial contamination hiding in rotisserie chicken, these products pose serious risks that multiply dramatically for anyone over 60. Your weakened immune system, slower metabolism, and medication interactions create perfect conditions for foodborne illness to become life-threatening. But knowledge is power. Now you know what to avoid, what warning signs to watch for, and why that convenient package or appealing price might be masking dangerous contamination. Check expiration dates carefully. Inspect packaging for damage. Trust your instincts when something smells or looks off. Choose fresh-cut meats over prepackaged options whenever possible. And remember, when it comes to your health, convenience isn't worth the risk. Your next grocery trip doesn't have to be a gamble with your health. Armed with this information, you can make choices that protect you from contaminated products while still enjoying safe, nutritious meals. Stay vigilant, stay informed, and most importantly, stay healthy. Your family depends on it, and you deserve nothing less than food that nourishes rather than threatens your well being.